everyone. Welcome to the medical information session on COVID-19. I'm Sriyani Senanayaka. I'm the SCATS Australia president. Just to brief about SCATS Australia. SCATS means Sri Lankan Study Centre for the Advancement of Technology and Social Welfare. That is SCATS Australia, established in 1992 by our founder president is Mr. Gamini Pereira, with to support Australian and Sri Lankan community at large in the field of education and social welfare. Our mission is for social advancement through science, technology, and innovation. SCATS Australia community services are recognized and supported by the local and state government in Australia, and we have been awarded in 2007 with Meritorious Award of Excellence. So we have a branch in Sri Lanka too. Currently, our president in Sri Lanka is Mr. Lionel Nagamua, and we work together when we do projects in Sri Lanka. So our areas of community services include education, training, and technology. For example, we have conduct computer training session for newly arrived migrants in the past, and seminars on variety of subjects for our Sri Lankan community, various competitions to recognize and reward innovative achievements. And also we have segment of cultural and art, and various projects have been done in relation to dancing, traditional dancing, music, arts, for example, musical shows by Sri Lankan popular artists, screening Sri Lankan films in Australia, multicultural concerts, art competitions, short drama and film festivals, and interfaith seminars. In terms of social welfare, we have done in the past medical equipment for Lady Ridgeway Children's Hospital, and also in Friendship Village for worst tsunami affected areas in the past, and donations to flood affected areas in Sri Lanka. At the same time, we have ongoing foster care student scholarship program that is called Sisu Savia, that was initiated in 1997, that aimed to assist and help disadvantaged children in rural areas in Sri Lanka for their education. We also have conduct Site First project, and for raising funds for the cataract surgeries, along with Lions Club of Sri Lanka. And we also have a segment of SCATS senior programs for supporting their social, emotional, physical well-being. Seminars, musical programs, yoga, religious programs. And also we have a SCATS youth program. It's about ongoing youth innovations, science and technology workshops. Currently in Sri Lanka, we are conducting CNA primary school project. That's 90% of the project is been completed, and we are building a model classroom and a library that still is in progress. And also in Australia, we are aimed to build a SCATS Studies Center building, and currently we are conducting fundraising events for that. Due to this COVID-19 pandemic, we had to stop all our events and activities. And recently, when we conduct our meeting, we decided to conduct medical information sessions to help the general public to understand this pandemic. We have to live with it. So Dr. Sanjeewa Hewavitharana, who was a former president, vice president of SCATS, and also currently he is one of our executive committee member, agreed to conduct this session. And I am invite Professor Priyantha Bendis to introduce him to you. Over to Priyantha.
Yeah, thank you, Sriyani, for that introduction to SCATS. And as we know, SCATS is one of the most active organizations in Melbourne and even Australia, with connecting the Sri Lankan and also the Australian communities, helping Sri Lanka. There are various projects. It's available in the website and so on. Also today, welcome, we have the founder president, Mr. Damini Perra, joining, and also former presidents. I see Vasant and Sarath, and also we have the secretary. So may the others joining. Welcome all joining this session. And because this is recorded, it will go to many people later on. And just to, we know that very brief introduction, we know that this is the worst ever crisis, as people think, the worst ever virus. And of course, Sanjeewa will mention all this, but and we know it's dragged on for more time than everyone thought, and 100,000 deaths itself in US. So it's a huge crisis and affecting everyone in the world, not just in one country or so. So it's really timely that this has been organized. And so we have in fact, experienced person who works on frontline, so-called frontline, working, helping everyone to really recover from this crisis and giving advice and so on. As we know, health professionals are doing a marvelous effort, helping the communities and all that, they're protecting the communities. So Sanjeewa is, of course, very well qualified to talk today, and it's more important, as Sriyani said, join link to SCATS as well. So thank you, Sanjeewa, for agreeing to give this talk. Very brief introduction to Sanjeewa. Sanjeewa's experience, specialist general practitioner with a history of working in metropolitan and rural healthcare industry in Australia, graduated from Western Australia and fellow of the College of Royal Australian General Practitioners. Actually, I can read a lot about him. He's done so many different things, medical and also just generally helping the community. So rather than taking time, can we invite Sanjeewa to present this talk?
Okay. Thank you very much, Professor Priyan and Sriyani, for introduction. So let me open my screen for the presentation. So okay. All right. So yeah. So as Professor Priyan mentioned, it's a timely session, which obviously we are in the middle of pandemic at the moment. So it's now, after some time, the countries are thinking of opening up the societies and looking forward. So I think it's a good time to talk about where we're at with this and then the way forward. So that's the reason I think it started this session. So let's talk about what's happening now. So if you look at current cases in the world, so we can see that it's, if you look in the month of February, so it's only minor, the numbers, it's only in one country, it's only in China up until whole February. But since March, people has gone out of China and spread almost everywhere in the world. So that's where it has become a pandemic. That's where the problem has started. So we can see that, since March, things has really gone pear-shaped and really increased into thousands, into 100,000s. So what we can see here is like, currently it's growing at about 100,000 cases each day. So if you look at the whole world, there's about 58 million cases of COVID-19 and also more than 360,000 deaths, which is like increasing about 4,000 deaths a day. So which is a huge number. So that's why it's very important at this stage for us to talk about this. So by looking at this, we can see that it's still growing. So the chart is still growing. The current daily cases are still growing, even though it's in a good control here. So we can still see it's growing around the world. So that's why we are considering we are only at the beginning of the coronavirus journey. We have just started. We have not even thought about the end at the moment. We just started. So let's look at the growth rate around the world. So now we can see we talk about the US most of the time because US has the highest number of growth. If you look at this chart now, they have more than 1.7 million cases with more than 100,000 deaths. So which is like really not a good number. So if you look at this, like more than 100,000 people died here. And looking at the Brazil, which is like next to US and then UK, more than 100,000, more than 300,000 in both these countries, more than 300,000 affected, more than about 30,000, 20,000 like people died in these places, and in Russia and in India, all these places, things are still growing at a very high rate. So that's why it's really, really worrying. But on the same time, we can look at the countries like New Zealand and Taiwan. So where they have had a really good control. So we can see in the same chart, it's not going, high. It's just controlled. So it's just going parallel now. So it's going parallel. So that means, they have made a good control. So we can see in Taiwan and New Zealand, they have stopped growing. And looking at Australia as well, we can see that, we have already made a good progress as well. So it's not growing like, straight. We are just able to manage the curve now. So we are at a good place, as well as Japan and South Korea as well. So China, they had a huge growth initially, but again, they managed to control. So that's what we see in the world now. See, next step is to see how we look at this pandemic. Just look at the daily cases. So we can see in the United States, daily cases are exploding. Like it's started like going up in the March and has really gone to 20,000, 30,000. And for the last 2 months, it has not controlled. So it's still going at about 23,000 cases every day. And again, in UK, same picture. So they have really gone up since April and then sitting at about 5,000, 4,000. Still it's not going down. So still they are having about 4,000 cases. And then when we look at India, which is like, another democracy, we can see that the cases slowly went up and then now really going up. And they're having more than 7,000 new cases every day. So that's, again, not a good picture. So all these countries, United States, United Kingdom, India, so things are not going in the right direction. But again, looking at Sri Lanka, so we are very like kind of looking at what's happening in Sri Lanka all the time. So we can see Sri Lanka had a really good control over time. So for the last couple of months, the cases were running at about 30, 40, so all the time. But suddenly we can see towards the end, for the last few days, the huge spike, like 60 cases yesterday, and then 150 cases before, and then again 50 cases day before. So that's the spike because of people coming back from Middle East, where there have been a lot of cases, new cases. So that's a bit of worrying if you look at Sri Lanka. It's a bit of worrying because if things can go out of hand here, unless have a good control, if the government doesn't do a good control in this area, things can go out of hand as well. So that's something for the government to consider in Sri Lanka. So this is another kind of chart we look at how the things are growing. So it's very important. If you look at United States, the number of cases are doubling every 2 months. So that's like we have 1.7 million cases today. So if the same rate continues, in 2 months' time, they have 34 million cases and could be more than 200,000 deaths. So that's not a good place to be. So that's something, you know, to be worried about. And again, with the United Kingdom as well, similar picture. Their cases are doubling at the moment, every 2 months. So yeah, again, totally on the opposite side, where we look at Hong Kong. So they have managed to control this very well. So if you look at the growth rate, they're only doubling cases every 12 years, so very long time. So they almost stopped growing. And then looking at New Zealand, they have effectively well managed the COVID-19 and they have stopped growing. So there's only a couple of countries in the whole world we have they stopped growing cases. That is, one is New Zealand and the other one is Taiwan. So we can see that they have effectively managed this condition. So that's the good news for some other countries to follow. You know, what have they done properly? Now let's look at Australia. So now if you can remember, like in March, you know, if everybody's worried and the cases has gone to 400 a day, and then sometimes 500 a day, and then some premiers were talking about, you know, turning exhibition centers and into hospitals. So that's the time the things were really worrying. But then the government able to do some good measures and, you know, able to bring down the rate into 20s. Like since April, if you think about last 2 months, the rate has been only 20 cases, around 20-25 cases for the last 2 months. So that's really good control. So we only had about 7,000 cases for the last 2 months with only 103 deaths. Plus, we are doing about 30,000 tests every day. Every day, 30,000 people getting tested. So far we have tested about 1.36 million, 1.3 million cases already been tested. So if you look at this number, like the positivity rate is very low. So out of 1.3 million people tested, only 7,000 being positive. So that's a really good number. So we have tested so many Australians and we didn't find so much infection around. So that's a really good news for us. If you look at Victoria, almost 500,000 Australians being tested in Victoria. So over 450,000 been tested so far. And if you look at the active cases, we can only see about 467 active cases. So there's only 21, very small number, currently in hospitals and 5 in ICU. Only 5, whole Australia in ICU at the moment. And only 2 people on ventilators as of today. So we are looking at a really good picture here. So the importance here is to manage this. How should we stay here? Not to go where some other countries has gone. And again, look at the growth rate in Australia. So we're just looking at how it's doubling the number. How long will it take to double the 7,000 cases? It's a 1 year, so a long time. So that shows we are in a good control. So let's look at another place where this is where we don't want to be, like in March, when things are really going high up in everywhere. We were talking about the countries where it had a good control. That's one of them is Singapore, and one of them was Taiwan, and one of them was Hong Kong. But out of Taiwan and Hong Kong, they still managed to control how things going. But this is where things gone wrong. In Singapore, they have not been able to manage the pandemic properly. So they have not done the measures properly. So then we can see that, you know, numbers has gone really high into 533, you know, more than 1,000 cases some days. So since beginning of April, things have really gone down. So they have about 33,000 cases already in Singapore for this short period of time. And then looking at the growth, we can see that every 2 months, Singapore is doubling the number. So that's similar to United States and United Kingdom. So by looking at this picture, we can see that Singapore is not in a good place. And especially when we look at the size of the Singapore, it's only size of Colombo district, if you compare. And again, the population of Singapore is only 5.6 million, which is like similar to the population of Colombo. So in such a small place, if you see so many infected, you can see that things are not in right direction. So this is where we don't want to be. So that's why it's very important for us to follow rules. So after looking at all these statistics, let's look at what is coronavirus. So coronavirus, it's a virus which is mostly found in animals. So this is a large family of viruses where only 7 has been found to be infecting humans. So all the other viruses in the family are only affecting animals. So there's only 7 which is causing infections to humans. So why this virus is called corona? That's because of this receptor we can see here. This receptor has a shape of a crown. So that's why they call this a coronavirus. So if you can see properly, you can see this receptor is like a crown. So that's the coronavirus. So that's why they call it corona. I think, yeah, we heard this again and again. So let's look at the symptoms now. So what are the symptoms of coronavirus? So I think we tend to talk about this again and again over the last few months, but still some people don't know what are the symptoms are. So the symptoms to watch out are coughing, fever, sore throat, chills, headaches, and breathing difficulties. So these are the main symptoms of coronavirus. So less frequently we get runny nose, less frequently diarrhea, and less frequently loss of taste or smell. So if you can look at these symptoms, it's all similar to normal cold. So that's why we have to worry about any cold we are getting. We have to worry whether it is corona or something else. That's why the things have become really tricky around the world. That's why it has become really tricky to find who's having the symptoms, who's passing the symptoms. Only very fraction of severe cases develop pneumonia initially. That comes usually later. So, and the other issue is like disease symptoms can emerge up to 14 days after getting infected. So you get infected and it'll take up to 2 weeks sometimes to show symptoms. So median days will be like 4 and 5. So that's why there's a quarantine period of 2 weeks has been introduced, because it's such a long time. Sometimes you can show symptoms. So this is the way forward, because there's a lot of talk about different drugs, different vaccines, but which I will talk later. But at the moment, there's no certainty on any of these. Only certainty we have with us is this one. This is our way forward. This is our map forward. So what we need to do is we need to keep our distance. We need to wash our hands properly. We need to avoid shake hands and avoid close contacts. And also when we are unwell, we need to sneeze. When you have sneezing or coughing, we have to make sure we are not sneezing or coughing into other people. We only sneeze into a tissue or into a crook of your arms. Also, when we are unwell, we should stay home. So let's talk about each one more in detail. The distance. So it's very important for us to keep the distance of 1.5 meters. So that's to protect our elder community, because that's the community which is mostly affected by this. So again, we have to make sure we keep the distance when we stand in the line. So we have to keep this distance of 1.5 meters. And also we have to keep the distance at meetings and events. Everything we do with other people, we have to make sure we keep this distance. Also, we need to make sure we need to avoid unnecessary contacts and large crowds of people. So when we have it with large crowds of people, we have to make sure that we are not doing any unnecessary contacts with other people. So we always need to keep the distance of 1.5 meters. And the next most important thing is wash hands. So we have to wash hands regularly. As when we go out of the house, we have to make sure, we have to keep in mind to wash hands all the time. So it's very important to wash about 20 seconds, both sides of the arm with soap and water. So that's itself is enough to clear the virus. So, and the other most important thing is to avoid touching eyes, nose, and mouth. That's where the virus goes into your body, through eyes and nose and mouth. So we have to make sure we don't touch our face and eyes, nose, and mouth with unwashed hands. Also, we have to avoid shake hands and avoid close contacts. Avoid touching and greeting other people as much as possible. And when we are unwell, so we have to stay as far as possible from others when coughing or sneezing. Also, we try to phase away when we do something like coughing or sneezing. And if possible, try to cough or sneeze into a tissue paper and then throw that immediately. If not, if you don't have tissue or something, make sure you at least sneeze or cough into a crook of the arm, not to your palms. And the most important other thing is when we are unwell, like in the past, we have a little bit of coughing, runny nose, we don't worry. We just go and do things as usual. We go to our sports, we go and do our jobs as usual, thinking, okay, it's just a small cold, but not anymore. Any small cold can be coronavirus. So that's why it's very important. If you have any symptoms of coughing, sniffles, sore throat, fever, we should avoid unnecessary contacts with other people, and we need to stay home. Not only stay home, we need to call our GP. We should not visit GP, we should call our GP clinic, or if you don't have a GP clinic, then we need to call the coronavirus information hotline, which is 1-800 number, which is free for everybody. So it's 1-800-020-080. So we need to call this number and then ask them, so, okay, what should we do now? So we have these symptoms, what's the way forward? So they will advise you how to do. So you either call your GP or call this number and they will advise you what's the next step you should be doing. It's very important, if you have any of these symptoms, you must get tested. It's free of charge for everybody, including overseas visitors, migrant workers, and asylum seekers. It's free of charge, and there's so many places we can get tested, which I'll show you in a moment. We should get tested, everybody. So that's the way forward. The only way to deal with this is to find the cases. If you don't find the cases, we will keep spreading. So, and I have put here some places where we can test. So it's just in Melbourne. So if you look at the areas around Melbourne, there's so many testing centers. There are so many testing centers around Melbourne. If you look at, like you'll say, in the eastern Melbourne, if you look at the 10-kilometer radius, so this you can see there's a lot of pathology clinics, they test for COVID. There's a lot of GP clinics, they test for COVID, and there's a lot of hospitals, they test for COVID, and there's a lot of mobile clinics which you can in shopping centers like Chadstone. There's a mobile clinic in Northland Shopping Centre. There's a mobile in Footscray Bunnings. There's a mobile in High Point Shopping Centre. There's everywhere if you look at around Melbourne. So this is similar across Australia. So a lot of places you can get tested. So all you need to have is some symptoms out of those lists, and they will test you. So it's very important. It's very important. The other most important thing is the COVID Safe app. So it's a mobile app designed to keep Australians safe and healthy by tracking cases within communities. So it's a voluntary app you download from App Store or Google Play, depending on your mobile device. So what it does is when you come into contact with others who are using the app, it makes a digital handshake using Bluetooth. So what it does is it records date, time, distance, and duration of contact. It just records it. And this information is securely encrypted and stores within the app on your phone. So it doesn't go anywhere. It just stays in your app, in your phone. This information is not accessible to anyone, including you, until a person is diagnosed with COVID-19 and they consent to uploading the contact information. So this only happens when somebody gets diagnosed and then they consent to uploading. So because a lot of people are worried about privacy with this app, privacy, and the government is tracking you. So but we can say that the COVID safe does not track where you are or what you're doing. So that's not the purpose of this application. This application is not made to track you what you're doing or whether you're doing something so not promoted by government, so nothing like that. So it just tracks the date, time, distance, and duration of the contact. So again, the COVID safe cannot be used to enforce quarantine or isolation restrictions or any other laws. So it's not made for that. So it is a criminal offense to use this app data outside the scope. So that's why it's you don't have to worry about using this, whatever the information, the date, time, or distance and duration of the contact kept in the app will not be used for anything else other than unless they are unwell with the COVID-19. So this app has been already downloaded by 6.1 million times as of today. So but still we have not reached the levels we need. We need about 35 to 40% of the population to get this app downloaded so that we can have adequate security, so that everybody we interact with have this app. But we are getting there, but still not there yet. So any of you not downloaded, I think it's a good time to just Google this name, COVID Safe app, and then you will be given the instructions how to download this into your mobile device. Let's talk about treatments, trials. There's only trials. There's no treatments at the moment. So we need one of the most popular one is a remdesivir. That's one of the antiviral medications used for Ebola in the past. So this medication has some trend towards reducing mortality improvement if started within 10 days of infection. So this is the only medication at the moment which has some effect on the virus, but still there's no 100%, so still studies are underway. So we have a long way to go forward on this as well. And the hydroxychloroquine, this has been a lot of talk in the past with the politicians getting involved with this drug and telling people, okay, it's good to take and all these things. But there's a recent Lancet study, which Lancet is one of the world's oldest and best known medical journals. So there has been a study done recently showed coronavirus patients taking this drug were at a higher risk of death and heart problems than those who were not taking this drug. That means if you had the coronavirus and if you've been taking this drug to prevent coronavirus, you have a higher chance of dying than a person who was not taking drugs. So it obviously works against you rather than for you. So that's why the WHO advised not to use this drug since this study. So that's the advice at the moment. So never use this drug because it will cause problems if you get diagnosed with coronavirus. On top of its side effects, there's certain side effects which known to with this drug about heart rhythm issues and eye issues, but this is another thing. You can have more issues of the risk of death and heart problems if you're diagnosed with the coronavirus on top of this drug. So that's a bad thing. So I think everybody should be taking this drug, should stop taking them. And there has been a lot of antivirals and other medications being tested in the past, like HIV drugs and the influenza antiviral drugs. None of them has been so far effective. So that's where the treatment of the virus stays at the moment. So let's look at the vaccines. That's the other thing everybody's talking about. So there has been more than 100 coronavirus vaccinations in the pipeline by various companies all over the world. Out of this 100, there's only 10 vaccines in the initial human trials at the moment. So when we develop vaccine, there's a usual sequence, like we'll say a preclinical animal studies. You start with preclinical animal studies, then we move to human trials of phase 1, 2, 3, and 4. So once we reach stage 4, that's when we pass stage 4, then only it becomes, safe to use on humans. So out of this 100, there's only 10 has reached the phase 1 or 2 of this human trials at the moment. Other 90 has not even gone there. So, and we heard a lot of news recently about, the experimental vaccine produced by American biotech company, Moderna. There's a lot of news recently. So this is the first coronavirus vaccine to be tested on humans back in March. So unlike more traditional vaccines, which contain weakened version of the actual virus or portions of the virus, this vaccine is based on the new technology of taking a genetic material, which is called mRNA, so genetic material from the virus, and delivering it to human cells, and then let the human cells to develop antibodies. So that's the kind of mechanism behind. But the experts say that although genetic vaccines are relatively easy and inexpensive to produce, none have been approved for human use in the past. So if at all they succeed in this, it will be one of the first of this type. So again, there's a lot of questions because they haven't tested on enough people. They only had tested on 36 people. So it's a very long way for them to go to another levels, like, when they go into the phases 2, 3, and 4, you have to test on a lot of people. So things can go wrong, especially when they're going to stage 3 and 4, where you test the vaccine on the general population. A lot of vaccines fail at that time. And there's a more traditional vaccine currently fast-tracked by Oxford Uni, and a pharmaceutical company called AstraZeneca, one of the largest pharmaceutical companies, combination of them. They're currently in human trials. They're in phase 1 and 2 at the moment, and they are hoping to test more than 6,000 people in UK by end of this month. So that's showing some promise. So that's kind of more traditional vaccine and done by a well-recognized companies and unis, and being tested on a lot of people. But still, the project leader of the Oxford vaccination recently warned the vaccine trial has a 50% chance of no result. So that's 50-50. So the project leader itself, so that's where we stand about these vaccines at the moment. So it can go either way. It can go successful or may not go anywhere. So that's where the treatment about this disease stays at the moment. So let's look at the key observations so far being made about this virus. So peak infectiousness, the most infectious time of a person is 1 day prior to the symptom onset. So that's why they made this virus so hard to control, because you become mostly infectious before you start showing symptoms. So by the time you start showing symptoms, you have already infected so many people around you. The other thing is that in the absence of therapy and vaccines, we talk about the therapies, not very successful, again, vaccines, a lot of questions, whether they will go there or not. Intermittent social distancing is the key and is likely to be needed for years. It could be like 1 year, or it could be 2 years, or it could be longer, to avoid overwhelming the ICU beds. So social distancing is the key all the time from now on and in the future as well. The other thing is the obesity. They found obesity is a risk factor for severity of the disease. So more obese, more overweight you are, more high risk for getting the disease. And the other thing is the clotting. So key feature of the COVID-19 is increased blood clotting. That's why it made it more problem for the heart attacks and all these things, because of the increased clotting of blood due to the disease. And the other thing is, as I talked about, the asymptomatic transmission is substantial. So a lot of people transmit the disease while they are not showing symptoms. So that's why it has been all over the world, out of control and finding hard to do anything. Another observation they were talking about is vitamin D deficiency. That's usually vitamin D deficiency is associated with the increased susceptibility of infection. So it's known that if you're low on vitamin D, you can get infections easily. So some recent studies found that the outbreak occurred, this outbreak has occurred in winter. This winter in the northern hemisphere, that's the time it started, at a time when the vitamin D concentration was lowest. And the other thing is the number of cases in the southern hemisphere near end of the summer. Our summer, because we were ending the summer, so that's why we have cases. That's one of the other studies saying. So we were coming to end of summer, so the number of cases are low. Other thing is the case fatality rate increases with the age. So cases become more fatal, more severe with the increased age, and also with the chronic diseases like diabetes, heart disease, and chronic obstructive airway disease and things like that. So both of which are associated with a lower level of vitamin D. So the few studies are finding some correlations between vitamin D and COVID at the moment. So because of that, public health bodies in England, Scotland, and Wales have revised recommendations on vitamin D supplementation since the pandemic. So stating that all adults should take at least 400 units of vitamin D daily. I think this is important for us as well, like considering the Melbourne, where everybody is low on vitamin D. I think we should take at least about 400 units of vitamin D daily till the pandemic is over. So at this level, it's not going to cause any problem, even if you don't know your vitamin D levels. At 400, which is a very low level, if you take one tablet a day, 400 unit tablet for 3 months, it's not going to cause any harm, even if you don't know your vitamin D levels. But if you know the levels, that's the best. The other study is like in the past, there's a lot of talk about the blood pressure medications, like ACE inhibitors. They are like the names with Coversil, Perindopril, those medications causing some problems with COVID-19, because COVID-19 is known to go into human cell through the ACE receptor, which inhibits by these medications. So people were initially worried about, taking these ACE inhibitors, are we causing us to be more prone to getting infections? But recent study shows that, like, no, there's nothing strong to say anything on that side. So we ask you to continue these medications. There's no reason to stop these medications, worrying about, just because we take these medications, are we getting high chance of getting the infections? Not at the moment. The other thing we need to talk about is the disproportionate effect of coronavirus on minorities. So there's some new data on coronavirus related deaths in the UK show that people who are Black or Asian background are more likely to die from COVID-19 compared to those of white ethnicity. That's concerning. So figures from ICU National Audit Research Centre in UK showed that 1/3 of 6,500 ICU COVID-19 patients up to the 30th of April were from non-white ethnic groups. In looking at England and Wales, the minorities only make up just 13% of the population. But here in ICU, about 33% are from minorities. That represents a higher number when you go to COVID-19. So this trend extends to health workers as well. So out of 106 health workers who died of COVID-19 up to 22nd of April 2020 in UK, 63%, huge number, were either Black, Asian, or minority ethnic background. That's worrying. And again, the number rose to 94%. Almost all doctors who died from coronavirus are from the minority groups. So there's some kind of a correlation. And now looking at the USA. So the USA analysis showed Black or African American people in New York accounted for 93 deaths per 100,000. And Hispanic, Spanish and Latin people, 74 deaths out of 100,000. Is considerably higher than the white people. Like, there's only occasions only 45 died out of 100,000. So that's a considerably higher level if you look at these numbers. So why it's happening like this? So what are the demographic variables put ethnic minorities at a greater risk for COVID-19? So that's because these ethnic minorities, like, they have higher prevalence of chronic diseases like heart disease, which is very common. We know heart disease, diabetes, and airway diseases is very common within minorities. And also the minorities are working in high-risk professions, like people who work in service industry, labor industry are more likely to be migrants. And there's also income equality and overcrowded living conditions when coming to these ethnic minorities. And also socio-economic status is low, and also accessing healthcare as well as access to resources, including social support, is low compared to the majority community. So further, the other thing is minority ethnic backgrounds are 2 times less likely to raise concerns about safety in their workplace. So compared to the majorities, like, they tend to work without raising anything because there's the risk of losing jobs. They're worried about losing jobs and things like that. So then they won't raise the safety in the workplace. That open them to get the infection more. So when looking at Australia, data around COVID-19 and ethnicity is limited, so because they have not recorded ethnicity around this data. But the researchers think the trends are similar, and they are not out of question here as well. So if it is there in US and UK, the trend has to be similar in Australia as well. So now let's look at the 3-step pathway for easing restrictions in Australia. So that's the way forward for us. So this is the roadmap for COVID safe Australia from now on. And each state and territories, they have their own times to move from step 1 to step 2 to step 3. So if you're just looking at the Victoria now, so we are in step 1 at the moment. We are being allowed to have 5 visitors to our homes, and we can have about 10 people together outside home at the moment. And then we can visit libraries and as well. And then we are allowed to do a bit of shopping at the moment. So this is how things are moved forward for us in the future. So let's look at the 3-step pathway for easing restrictions in Victoria. So from 1st June, which is like 2 days from now, we will be moving to step 2. So there we will be allowed to have 20 people in our houses. This includes our household as well. So if there are 4 in the family at household, then you can have about 16 people coming from outside. And people will also be allowed to stay overnight with their friends and family or at tourist accommodation. So far we have not been allowed to stay overnight with outside of your home. So up to 20 people can sit inside an enclosed cafe or restaurant as long as social distancing requirements are adhered. So social distancing is the key now. And travel to holiday homes and other private residences within Victoria is allowed as well. So you can't go interstate, but you can travel within Victoria. And 20 people can play sport together outside. You can't play inside, but outside you can play as long as they are not competitive. So if you're not practicing, if you're just practicing or if you're playing for fun, you can do that. And the main thing is Victorians are still urged to work from home if you can. So still, we are not encouraged to go out and go to office at the moment. If you can work from home, you should do that. Universities and TAFE is not open as yet. So they're still recommended to learn remotely. And childcare and kindergartens are already open. And from grade 3 to year 10, we'll return to face-to-face learning on 9th of Tuesday, because we already started grade 1 and 2 and 11 and 12 at the moment. Libraries, youth centers, community clubs can reopen with no more than 20 people inside at a time from next Monday. So let's look at from 22nd of June, this will be further extended. If things go well from now on, like for the next 2 weeks, from 22nd of June, step 2 will further extend it to include 50 people to sit inside a cafe And indoor sports centers and venues will be open to 20 people with social distancing. Gyms, fitness centers, health clubs can be reopened to 20 people. And there are plans of ski season to go ahead at the moment as of 22nd of June. And up to 50 people will be able to see a movie at a cinema or go to concert or theater from that day onwards. So then the further easing of restrictions are planned for the second half of July, which is the step 3. If all these go well for another couple of weeks from this time, and if all goes well, then there's a good chance that we'll be able to gather for up to 100, return to workplaces for full-on work, and then interstate travel to be opened as well, depending on that, and food courts, saunas, and bathhouses to be open. So all of this will happen. It all depends on us, how better, how well we follow the rules. This is our guideline. This is all we have at the moment to fight against the virus. So keep the distance. We have to wash our hands as much as possible. Avoid touching face without washing hands. Avoid shaking hands and avoid contacts. And when you're well, stay home. Anything, any sniff, any small cough, stay home and get help from your GP or from the coronavirus helpline to make sure you're not having any of that side. And also when you sneeze or cough, make sure you don't stop the sneeze or cough to other people. So this is the way forward from now on. So if you follow all these guidelines, I'm pretty sure we will be able to move to stage 3 as well very soon. But if you don't follow these guidelines, things can go back. So from step 2, we can go back to step 1. So that which has happened in countries like South Korea just before. So that's why this map is very important at the moment. So with that in place, I probably finish my talk and then probably open the for some questions.